Dear ladies and gentlemen, my name is Yunusov from Uzbekistan, and it's a great honor to have opportunity to present our topic, overcutting, as a main risk factor of developing bladder neck contracture after endoscopic surgical treatment of BPH. As you know, currently, transurethral resection and endoscopic enucleation of the prostate are the gold standards of endoscopic surgery for benign prostatic obstruction. Nonetheless, many complications such as bladder neck contracture still occurs after endoscopic surgery for benign prostatic obstruction. There are many theories and risk factors concerning development of bladder neck contracture. This study aims to determine the main risk factor of postoperative bladder neck contracture by providing a retrospective analysis the groups of patients who have underwent endoscopic prostate resection and enucleation. Study design, materials and methods. We retrospectively analyzed the complication reports of 458 patients who underwent TURP and EAP for symptomatic BPH during the period of 2016 and 2019. Patients are divided in two groups, TURP group with 213 patients and EAP group with 245 patients. The patients in all two groups had comparable characteristics, IPSS score, Qmax, voiding residual urine, prostate volume, urine tract infection, all of them done before surgery. All interventions are performed by single expertise surgeon using 2 or 3 lobe enucleation techniques and bipolar energy for TURP. During endoscopic enucleations of the prostate were clearly seen and separated bladder neck structures, avoiding their damage, following perioperative and follow-up clinical data being collected. And we had the following results, as you can see in table. After TURP and EAP, we observed the following intraoperative and early postoperative complications, such as severe hemorrhage, bladder neck injury, fever due to UTI, the bladder tamponade, and acute urine retention, with better results in EAP group. At the 6-month follow-up, patients in all groups had a significant improvement from baseline in IPSS score, Qmax, and post-voiding residual urine. In both TURP and EAP groups were included delayed complications such as urethral strictures in 2 patients in TURP group and 1 patient in EAP group. Stress incontinence, 1 patient in TURP group and 4 patients in EAP group. Continued urine tract infection, 16 patients in TURP group and 22 patients in EAP group. Bladder neck contracture in the postoperative period were diagnosed in 3 patients in TURP group, but which accounts for 1.4%, and we didn't observe such complication in enucleation group. And we believe that correctly performed endoscopic enucleation of the prostate preserved the bladder neck by clear identification of plane between adenomous and surgical capsule. In contrast, transurethral resection of BPH may overcut and damage bladder neck due to difficulties in differentiation of underlying structures. In our opinion, other risk factors such as prostate volume, UTI are minor and only worsening ones. But these statements are required further well-designed research in a large cohort of patients. And concluding message is that preserving the bladder neck during endoscopic surgical treatment is the key point in avoiding of its contracture. Thank you very much for your attention.